As burns and wounds heal, the skin becomes tight. It will be important for you to follow the stretching and exercise instructions given to you by therapy staff. If stretching and exercise are not done, you may have limited function or lose the use of certain body parts. If this occurs, more surgeries will be required in the future. A scar continues to develop up to 18 months after an injury, so stretching will be very important for a long time. Everyone's skin heals differently. Not all patients require skin grafting, and some require multiple surgeries. You'll have the best outcomes from your injury if you follow the instructions of the burn team. Please let us know if you do not understand something or if you have questions. This video will demonstrate how to stretch burned skin that is healing. It is very important to follow the direction of the physical and occupational therapist for your stretching, scar massage, splinting, and walking programs. We are going to focus on stretching of the skin that has a burn injury. We will start off stretching your fingers and your thumb. There are a few things to keep in mind. We want to isolate each joint with stretching, so we will start with the knuckle joints in the hands. When we help with the stretching, we like to use a wide open palm. Place the palm over all the fingers and help pull down to provide a stretch over the knuckles until you see the skin turn white. Hold that for 30 seconds to make sure you get an adequate stretch. It takes that long for the skin and tissues to stretch. After holding for 30 seconds, relax and straighten your fingers. You should complete this at least 3 to 4 times every hour. Then move down the finger and stretch the next knuckles there. The more you can do, the better it is, but again, we want to hold the stretch to get the skin moving. Again, you can see where the skin and tissue turns white, and then you know there is an adequate stretch there. Now make a fist to combine all the joints. Here you see the whiteness across the knuckles. If someone is able to help, have them place an entire hand over the fist and help hold that for 30 seconds. Now we are going to work on stretching the thumb. Take your thumb, bringing it over to your pinky, and hold it there. You can put another finger here to give it more of a stretch and hold that for 30 seconds. Then bring the thumb back out straight. Now bend your thumb at this middle knuckle joint and hold onto the nail. This provides stability at the bottom of the thumb to get it a little bit more of a stretch. As you can see here, the skin turns white, and then you know you're getting an adequate stretch. Hold and release. Next, work on taking your thumb by touching the tip of each finger. When the burn comes down between the web spaces of the fingers, you will want to separate the fingers by pulling them apart. You can also provide a little bit of a firm pressure within that web space. Hold it, then release, and move on to the next fingers. It is important that you do not forget about the thumb. Make sure you pull the thumb out to the side again, providing some stability at the bottom joint. Hold on to the rest of the fingers to get a nice stretch. You can also provide some pressure through the web space as shown here. Once grafted skin is healed, we can use a technique called scar massage. To do this, you press on the skin until you see the skin blanch or turn white. At that point, you can take the skin and move it side to side. You can see the blanch of the skin here. Move the skin in all directions, up, down, and in circles. You can also help to stretch the arch of the hand by pulling the skin to the side. Again, notice the scar turning white in color. You should stretch all joints that were burned or grafted. Here we are going to stretch the knee. First, bend the knee straight up until the skin turns white or blanches. It is important to maintain the stretch for at least 30 to 60 seconds. While it stretches, you can apply pressure to areas that seem raised, and you can do a scar massage as well. It will be important for you to actively participate in your stretching also. Bend your knee up and down at least 5 times. To help maintain the motion we have gained from stretching, we can also use a splint to maintain a good position. We will demonstrate here by applying a hand and wrist splint. It is important that the hand and wrist are all the way in the splint for best positioning. Try to get the hand and wrist to make full contact with the splint. Once in position, fasten straps snug so the hand and wrist do not get out of position. You should always check the skin before and after wearing a splint to watch for skin irritation or breakdown. It is important for you to be out of bed and walking several times per day to help with recovery. You need to be careful how you get out of bed to avoid any trauma to newly grafted skin. When walking, try to walk as normal of a gait as possible, stand up tall, and walk heel to toe. If you have any questions or concerns, please call us at 319-356-2496 or toll free at 1-800-777-8442.